Hello, today we will look at which medications that are not allowed to give in heart failure. So we have a heart failure patient, and we have this heart failure patient having other diseases also. For example, if the other disease is diabetes mellitus. This patient has heart failure and diabetes mellitus. Then the patient needs to be treated for both of these. And for example, if we treat diabetes mellitus with Metformin, which is one of the most important medications for diabetes mellitus, then we have a problem. Why? Because Metformin is one of the medications that are not allowed to be given to a patient with heart failure. So if you have a patient with heart failure and diabetes mellitus, then please choose another anti-diabetic medication. So not Metformin, and also not thiazolidinediones. These are the two medications that you are not allowed to give. So please look at other medications. I often see in the hospital that we have doctors that are giving Metformin together with ACE inhibitors and all the other medications for heart failure. And that's a big problem, because this can cause something called lactic acidosis, and this can be deadly. So the patient can die of this. This is not a joke. And I often see in the hospital in the charts that when we look at the medications that we have Metformin, and then we have ACE inhibitors and all the other medications for heart failure patients, and this is not allowed. Okay, good. The other medications that we can see in the chart, for example, that are not allowed is anti-arrhythmic medications, class 1 or class 3. There can also be non-steroidal anti-inflammatory drugs. These are also not allowed to be given, non-steroidal, and this is also very common in the hospital. So non-steroidal, Metformin, thiazolidinediones, we have this class 1 and class 3 anti-arrhythmic drugs. We also have some other chemotherapeutic medications like cyclophosphamide. This is not allowed. So you see, there are a lot of, there's a whole list of medications that are not allowed to be given in heart failure patients. I will only mention the most important one and the most commonly used. For example, in the neurological department or neurological diseases, we usually see carbamazepine. This is not allowed to be given. Or in the psychiatric unit, we see usually tricyclic antidepressants. When we give antibiotics like Metformin sulfamethoxazole, this is one medication, this is not two medications, it's a very long name, I know. Metformin sulfamethoxazole. This, together with ACE inhibitors and all these, can cause severe acute kidney injury, can cause hyperkalemia, which is a high level of potassium in the blood, and all these are very dangerous because you can get arrhythmias and die. Okay? What else do we have? Interesting thing that I've written down is, for example, phosphodiesterase inhibitors. For example, we have type 3, type 4 and type 5. Type 3 phosphodiesterase inhibitors are, for example, silostazole. So we have a patient who have peripheral artery disease. Peripheral artery disease patients usually are treated with silostazole. This is phosphodiesterase 3. But it's not allowed. So please choose another medication there. Or if you have phosphodiesterase 4, for example, anagrelid. I hope I spelled it right correctly. Anagrelid. This is phosphodiesterase 4, and usually it is used when we treat, for example, essential thrombocythemia or polycythemia vera. These are two hematological diseases. Please stop that. It's not good. Phosphodiesterase 5. This is the most common, the most known one. Why? Because it is used for treating erectile dysfunction for males. So when it's not working, then you get sildenafil. This sildenafil is the phosphodiesterase 5. And usually when you give that together with hypertensive medication, then the blood pressure can drop to a very low level, which can cause you hypotension, which means that it's a very, very low blood pressure that is dangerous. So you're not allowed, for example, to use nitrates together with sildenafil. You have to wait at least 24 hours. So if you took sildenafil for erectile dysfunction, then when you come to the hospital and you have, for example, heart failure, then please never give nitrates to these patients within 24 hours. Okay? It's very, very dangerous because the blood pressure will drop too suddenly. Good. What about digoxin? Digoxin, it has been seen that when you have an acute exacerbation of heart failure, actually the clearance of digoxin can decrease. And this is very dangerous because digoxin is actually toxic when you're increasing the dose too high. So clearance means that the excretion of digoxin is not functioning as it should, and therefore the concentration builds up in the body, and then you can get toxicity, and you need to monitor this. You need to take lab values and check the digoxin level. Good. So I think this is pretty much the most important medication. So let's take them one by one. We have a diabetes mellitus patient with a heart failure patient. Which medication are we not allowed to give? Metformin or thiazolidinediones. We have a patient who has infection and heart failure. Which medication are we not allowed to give? Trimethoprim sulfamethoxazole. We have a patient who is depressed and he has heart failure. Then which medication are we not allowed to give? Antidepressant, tricyclic antidepressant. Or carbamazepine is another neurological medication that we're not allowed to give. We have a cancer patient with heart failure. Please don't give cyclophosphamide, for example. There are other chemotherapeutic medications that you're also not allowed to give, but I will not list them all. I just mentioned one of them. You have arrhythmias, so the rhythm disturbances of this patient, which together with heart failure. Which medications are we not allowed to give? Class 1 and class 3 antiarrhythmics. But amiodarone is the best one when it comes to antiarrhythmic drugs together with heart failure. So you can use amiodarone together with medications for heart failure. So this is the one that are the best use for antiarrhythmics. Good. Then we have a patient with erectile dysfunction and heart failure. Which medication are we not allowed to give? Sildenafil. Okay. When the patient has essential thrombocythemia or polycythemia vera together with heart failure, you are not allowed to give the phosphodiesterase 4, which is anagrelid. We have a patient with peripheral artery disease and heart failure. We are not allowed to give silostazole that we usually give. Good. And non-steroidal anti-inflammatory drugs, as we said, are very commonly prescribed. This is one of the most common medications that we see in the hospital, and please stop that. Okay? Non-steroidal should be stopped. Also glucocorticoids like hydrocortisone, this should also be not given. Okay? So I thank you very much for listening, and I hope that next time that you see your own chart, if you're a patient and you see that you have these medications and you know that you're a heart failure patient, then please talk to your doctor. And if you're a doctor and you see this in the hospital, then please remove these medications, or please talk with other doctors and then decide which medication you need to switch to. Because if you stop something, you need to switch to another medication. Good. I thank you very much for listening.